Welcome back. The Ministry of Health and Social Services has announced that the Mpox and Crimean-Congo hemorrhagic fever outbreaks recorded in the Erongo and Omaheke regions have been successfully contained. Now, to tell us more about what this means is Mr. Walters Kamaya, the Public Relations Officer at the Ministry of Health and Social Services. So good evening and welcome. Thank you so much for being here.
Good evening to you, to Nina, and good evening to the rest of the crew in the studio.
Well, of course, this is always great news to the Namibian public when we hear something like this, and the ministry has now officially announced that Mpox and Congo fever have been successfully contained. But in practical terms, Mr. Kamaya, tell us what this means.
Yes, in practical terms, what we mean to say we have successfully contained that is to say that it's over. We have declared it over. All the cases which we identified, those cases have recovered successfully, and then we do not have any other cases, neither suspected cases or maybe pending laboratory results. So in simpler terms is to say that that outbreak which we announced, it is now over. But not saying the disease itself is over or we have triumphed over it, but it's just to say that those cases, they are now over.
And just to refresh our memories, we recorded 3 confirmed Mpox cases, all of whom recovered. Talk to us about the measures that helped, ensure that the virus didn't spread any further.
Yes, the measure is the one that we have been singing as a Minister of Health and Social Services, such that we can say it's our anthem. We usually say that it is good for ourselves to have what we call the health-seeking behavior. First of all, if we can all cooperate. And then when I say that if we cooperate, what do I mean by that, Nina? What I mean is that when you feel that you have strange symptoms within you, please make it your responsibility to seek health, to seek a medical care by going to any of the facilities and disclose to us to say that, no, I am feeling these symptoms. When did they start? How do you feel them? And also to discuss with us your traveling records so that through that we are able to screen and diagnose and advise further. But when we come to this Mpox cases, we had to struggle to try even people to tell us their contacts, of which if you try to hide information, if we face refusals, if we face hesitancies, we will definitely not be able to rise beyond the challenge. But when the members of the public come clean to our facilities and engage our healthcare workers, definitely we will be able to reach a consensus, both of us.
Well, unfortunately, Mr. Kamaya, the one recorded Congo fever case in the Omaheke region did result in a death. But talk to us about, the main risks associated with this specific disease.
Yes, the main risks that I do associate, let me to start by saying that the outbreak was detected on the 28th of November last year, after a laboratory confirmation on the 21st of November. So the risks, it's transmitted through the tick bites. And then when you have these tick bites, in most cases, we do advise our farmers to handle their animal with care. When necessary, also to use gloves when they are handling their animals to avoid those tick bites. Also, it can also transmitted through bodily fluid. So when you exchange bodily fluid with an infected person, you can also get it. And then we also tried to speak about the issue of livestock to farmers. How do we conduct them? So those are the primary factors of or the way in which it can be transmitted from one person to the other.
Yeah. Well, you mentioned earlier, of course, the contact tracing that played a role, of course, and how important it is for individuals who do get tested and test positive to be transparent about who they've been in contact with, in recent days or weeks. Surveillance, you mentioned, and of course then community education also played a role in containing these outbreaks. So tell us a little bit more about how these strategies were implemented by the ministry.
Yes, these strategies, it was simple. It was just to engage the community members. And then these strategies, one of them is to get is to work hand in hand with the laboratories to get those cases tested and get the results. So in most cases, when our healthcare workers get to the community to discuss, to give them public health education, it's something that one should decide to live by, But if you try to ignore, in most cases, we try to rely on our traditional practices, thinking that, or maybe what I've seen based on experience, we do not take things seriously until we are in a situation. That's when we realize that, no, we have heard about this. But nevertheless, when you are in a situation, make it a point that you visit the nearest public health facility for screening.
You mentioned earlier, Mr. Kamaya, that the Mpox now has been contained, but the virus itself, of course, has not disappeared. So should Namibians still be concerned about Mpox or Congo fever or not?
Not for now, but prevention is always better than cure. We are saying that we cannot encourage people to relax and say we have arrived. But what we are telling them is that it was contained, it's over, it's not within our community or in that region anymore. But we cannot say that it's over, country worldwide. But in that region, it's over. But we are still appealing to people to be vigilant and alert and to cooperate with the healthcare workers in case when they don't feel the way they used to feel or when they feel in unusual way.
Mr. Kamaya, any final remarks before I release you?
Yes, the final remarks, I would just say that this was successful because of the working hand in hand with the Minister of Health and Social Services, and then we would like to encourage that that relationship to grow from strength to strength for us to be able to rise above these outbreaks. And we also want to encourage people to say that the ministry is conducting a variety of campaigns. We just ended the polio round 2 vaccination campaign, which was successful. Also, we want our people to participate in these campaigns for their own good. Where they don't understand, we are open to give public education to them at any time, at any of our facilities. And then we also want to wish them the best. We say that a healthy nation is a prosperous one.
Yeah. Mr. Kamaya, always lovely having you with us. Thank you so much for being here.
Thank you. It was my pleasure for having me on this program for Daily Roundup.
Thank you. We'll be back with more.